Imagine this scenario, and it's something truly distressing to witness.
Yeah.
Your dog, normally happy, active, is suddenly really struggling to walk.
Yeah.
Their paws are thick, they look hard, incredibly painful, and they're maybe even starting to crack and bleed.
Awful.
And you look closer, and you start seeing these raw, kind of crusty areas showing up around their muzzle, their eyes, their ears.
Mm.
It's, well, it's a really puzzling and severe skin problem. It doesn't
Really?
look like anything you've seen before.
It's absolutely heartbreaking to see an animal suffer like that. And, for their owner, it's often terrifying because what looks like just a really bad skin issue on the outside is, like you said, usually a sign of something much, much deeper going on.
Exactly. And that's precisely where we're heading in this deep dive today. We're looking at a rare but very serious condition. It's called necrolytic dermatitis.
Right.
You might also hear it called superficial necrolytic dermatitis or hepatocutaneous syndrome. And those names kind of hint at what's really happening underneath.
They do, yeah, those names are definite clues. So our mission today is really to unpack the sources, pull out the most important insights, and try to truly understand this condition. What actually triggers it? What are the telltale signs? How do vets figure it out? And crucially, what does it all mean for the animals affected?
And here's the core thing, the sort of aha moment right up front.
Hmm.
Those really dramatic, painful skin lesions, they're almost always just the outward symptom.
Yeah, a marker.
A visual marker, exactly, indicating a much more serious metabolic problem happening deep inside the body. Usually this points to advanced liver disease or sometimes less often a specific kind of pancreatic tumor.
The skin is basically reflecting this profound internal imbalance. It's quite striking.
Okay, so let's dig into that a bit. What exactly is necrolytic dermatitis and why does it happen like that?
Okay, so at its core, it's a severe degenerative skin disorder. Necrolytic, it literally means the skin cells are dying off, breaking down in the upper layers of the epidermis. It's pretty uncommon in dogs and incredibly rare in cats.
And you mentioned it's a marker for serious internal disease. How does a problem way down in the liver or the pancreas actually cause the skin to break down so dramatically?
Right, that's the critical connection. The leading theory, and it's strongly supported by the evidence, is that the skin damage is caused by severe hypoaminoacidemia.
Hypoaminoacidemia, so really low levels of amino acids in the blood.
Exactly. Critically low levels. Amino acids, they're the basic building blocks for proteins.
Right, the body needs them for everything.
Absolutely. Think of skin cells, especially those upper layers, the keratinocytes. They need a constant, robust supply of these building blocks just to survive and function properly.
Okay, so why would the amino acid levels get so low?
Well, there are two main scenarios. If there's severe liver disease, the liver is basically failing. It just can't produce, process, or regulate amino acids like it should. It also struggles with other jobs, like making glucose.
Okay, so a failing liver messes up the supply chain.
Pretty much. Now, the other possibility is a glucagon-secreting tumor, a glucagonoma in the pancreas. This tumor pumps out way too much glucagon.
And glucagon tells the body.
It tells the body to make glucose, often by raiding the body's amino acid reserves to use as fuel for that process, so it severely depletes the amino acids available in the bloodstream.
Wow. So either the liver can't make them properly or this tumor is causing the body to burn through them too quickly.
So either way, you end up with this drastic shortage of amino acids in the blood.
And that starves the skin cell.
Precisely. Those keratinocytes in the outer skin layer, they have a really high demand for energy and protein building. Without enough amino acids coming from the blood, they just can't make the proteins they need. They can't generate energy right. They start to swell up, degenerate, and eventually they die off.
So the crusting, the cracking, the pain, it's the physical result of the cells breaking down from lack of fuel.
Yes, that widespread cell death and breakdown in the epidermis is the physical manifestation of that amino acid starvation. That's why you see the crusting, the erosions, the painful fissures.
Skin is literally falling apart because it's missing its fundamental building blocks for the rest of the body. That's a really powerful connection.
It really is. The sources also mention that maybe deficiencies in specific amino acids or maybe even zinc or essential fatty acids could play a role or make things worse. But the main driver, the big problem, is usually that system-wide lack of amino acids caused by the liver disease or the tumor.
And who usually gets this? Is it certain breeds or?
It's mostly seen in older dogs, often, over the age of 10.
Yeah.
The sources don't really point to any specific breed being more prone than others.
Right. Older dogs. Okay, so we understand the why this skin cell starvation due to a deep metabolic issue. Now, what does this starvation actually look like on the animal? What are those key signs we should be aware of?
Well, the skin lesions are definitely the most dramatic thing you see, and they often pop up first. Sometimes weeks, maybe even months before the animal starts acting really sick from the internal problem.
Really, the skin shows up before they seem generally unwell.
Often, yes. And the lesions have characteristic locations, usually areas that get a lot of friction or pressure, and also what we call mucocutaneous junctions, basically, where skin meets mucous membrane, like around the mouth or eyes.
Like those incredibly painful paws you mentioned at the start.
Exactly. The foot pads are one of the most common spots and often most severely infected. They get incredibly thick and hard. That's called hyperkeratosis. And they develop these deep, really painful cracks or fissures. They can get very crusty too.
And that obviously makes walking painful.
Oh, absolutely. Because they hurt so much, dogs are often really reluctant to walk or they become noticeably lame. It's awful to watch.
I can only imagine. Where else do these typical lesions show up?
Other common places are around the muzzle, so the lips, chin, around the eyes, also the ear flaps, the genitalia, and then on those bony spots that get pressure, like the elbows and the hocks.
And can you describe the lesions themselves a bit more? What do they actually look like?
Sure. You'll typically see redness, obvious crusting, raw areas where the top layer of skin has eroded away. Sometimes you get deeper open sores, which are ulcerations. There's usually hair loss in those spots too, and the skin itself can feel kind of thick and tough.
And I imagine infection could be a problem.
Oh, very much so. Because the skin barrier is so damaged, secondary bacterial or yeast infections are super common. That can lead to discharge, oozing, sometimes even a pretty bad smell. And actually, in the very early stages, you might even see small blisters form.
Is it usually an itchy condition for the dog?
You know, that seems to vary quite a bit. Some dogs don't seem particularly itchy, but for others, the pruritus can be really severe.
Okay. And you mentioned it's very rare in cats. Do they show different signs if they do get it?
Yeah, based on the few reported cases in cats, you might see more widespread hair loss and scaling, maybe over the limbs and body, along with that crusting and thickening of the paw pads, kind of similar to dogs.
Got it. So these specific, often really painful skin lesions, especially hitting the paws and face, that's the big flashing warning sign on the outside. But what about the signs of the internal disease itself, the liver problem or the tumor?
Right. The systemic signs, the signs that they feel unwell overall, they're often less dramatic at first. They can creep up slowly. You might just see general lethargy, maybe some depression, poor appetite, maybe gradual weight loss over time.
That could be for lots of reasons, right?
Exactly. It could be nausea from the liver dysfunction, just general discomfort, or even just the pain from lesions inside the mouth, making it hard or unpleasant to eat.
What other internal signs might eventually appear?
Well, if the underlying issue involves diabetes or with severe liver disease, you might notice the dog drinking and urinating a lot more. PUPD, we call it. Occasional vomiting or diarrhea can happen too. As the disease gets worse, you might see muscle wasting. And then, signs more directly pointing to serious liver problems could include an enlarged liver that the vet can feel, or jaundice, that yellowish tinge to the gums, skin, or the whites of the eyes.
And in really severe cases.
And, very advanced liver failure, thankfully it's less common, but you could potentially see neurological signs, maybe even seizures.
So recognizing that unique pattern of skin lesions is really the crucial first step.
Yeah.
That's what makes a vet even think about this serious underlying problem. How do they actually go about diagnosing it?
That high index of suspicion, just based on seeing those characteristic skin lesions, is absolutely key. It prompts the vet to start thinking, okay, could this be necrolytic dermatitis? And then start ruling out other things that might look a bit similar on the surface.
What kind of things might look similar? What are the lookalikes?
Well, the sources mention conditions like autoimmune skin diseases, pemphigus is a big one, maybe severe zinc deficiency, sometimes really bad drug reactions, or even certain fungal infections can cause nasty skin issues. But the specific distribution and the nature of the lesions in necrolytic dermatitis usually helps point the vet in the right direction.
Okay, so suspicion is high. What's the test that really nails the skin diagnosis?
A skin biopsy. That's crucial for getting a definitive diagnosis of the skin condition itself. And it's important to take the sample from the edge of an active lesion, one that shows the changes but hasn't completely broken down into an open sore yet. Getting a good depth is important too.
And what makes that biopsy definitive? What do pathologists see under the microscope that screams, necrolytic dermatitis.
Ah, this is one of the most fascinating bits. Under the microscope, the biopsy shows a pattern that is practically unique to this condition. Pathognomonic, we call it. It's often described memorably as the red, white, and blue pattern.
The red, white, and blue pattern. Okay, tell me more.
It's pretty cool visually. So when the pathologist looks at the layers of the epidermis, they see these distinct changes. The very top layer, the keratin, is thickened and abnormal, often retaining cell nuclei where it shouldn't. That's often described as the red layer due to staining.
Okay, right on top.
Then just below that, in the middle layers, the keratinocytes are swollen, pale, look kind of empty. That's the white layer, vacuolar change.
White in the middle.
And then the very bottom layer, the basal layer, where new skin cells are born, shows increased cell numbers and activity, like it's trying really hard to regenerate. That often stains darker, hence the blue.
Red, white, and blue. Wow.
Yeah, that specific three-layered appearance, perikeratotic hyperkeratosis, red, epidermal edema, or evacuation, white, and basal cell hyperplasia, blue. If you see that pattern, it's basically diagnostic for necrolytic dermatitis.
That is a very specific microscopic signature. Okay, so the biopsy confirms the skin changes. What about blood tests? Do they help figure out the underlying cause?
Oh, absolutely. Blood tests are essential for investigating that internal metabolic mess. The most consistent and really significant finding, the one that's considered pathognomonic, if you confirm it, is those low plasma amino acid levels. That severe hypoaminoacidemia we discussed.
But that needs special testing, right?
It does, yeah. It's not part of a standard blood panel, so you have to specifically request plasma amino acid analysis.
But confirming those low amino acids really ties the whole picture together.
Yeah.
What else might show up on, say, routine blood work?
Yeah. Routine blood tests often show clues pointing towards severe liver disease. For instance, albumin, that's a protein made by the liver, is frequently low.
Okay.
Liver enzyme levels, things like ALT, ALP, AST, GGT, are typically elevated, often really quite high, especially ALP. That indicates liver cell damage or stress.
Makes sense.
Bilirubin and bile acids might also be high, showing the liver isn't clearing waste products properly. And, of course, if there's underlying diabetes or glucagonoma, you'll likely see high blood sugar, hyperglycemia. You might also see things like anemia or changes in white blood cell counts.
What about looking inside? Can imaging like an ultrasound help?
Yes, absolutely. Abdominal ultrasound is highly recommended. X-rays usually don't tell you much here, but ultrasound lets you visualize the internal organs, especially the liver and the pancreas.
And what might you see?
What's really remarkable is that in cases linked to liver disease, the liver on ultrasound can have a very characteristic look. It's sometimes described as having a honeycomb or Swiss cheese pattern.
Honeycomb or Swiss cheese? That sounds distinctive.
It is. This diffuse, sort of patchy appearance is often quite suggestive, sometimes even considered pathognomonic, for the specific kind of liver damage, the vacuolar hepatopathy associated with this condition. And of course, the ultrasound is critical for looking closely at the pancreas to search for any mass that could be a glucagonoma.
So the ultrasound can often strongly suggest the liver is the issue, or maybe even spot a tumor. Is a liver biopsy ever needed to be absolutely sure about the liver disease?
Yes, in some situations, a liver biopsy might still be needed to get a definitive diagnosis of the exact type of liver changes that are happening.
All right. So diagnosis involves recognizing that skin pattern, confirming it with that unique red, white, and blue biopsy, finding the low amino acids in the blood, and often seeing characteristic changes on ultrasound or maybe finding a tumor. Now, the tough part, what can actually be done to help these animals once they're diagnosed?
Yeah, this is where the tough reality of the condition really hits home. Treatment is primarily focused on two things: trying to manage the underlying metabolic problem, if possible, and providing really intensive, compassionate, supportive care for those incredibly painful skin lesions. A true cure, unfortunately, is rare.
Because the underlying issue, the liver disease or the tumor, is usually pretty advanced or irreversible.
Exactly. Now, there's one exception. If a glucagonoma is found before it has spread, and if it's in a location where it can be completely surgically removed, that offers the best, really the only chance for a potential cure. If the tumor is successfully removed, the skin sign should resolve.
But that's not the common scenario.
No. As the sources really emphasize, most cases we see in dogs are linked to severe, chronic, irreversible liver disease, and you simply can't cure that kind of end-stage liver failure.
So for most dogs, the focus shifts to managing symptoms and improving quality of life, right? What's the most effective thing for the skin lesions themselves?
The sources consistently highlight intravenous amino acid infusions, giving amino acids directly into the vein as the most effective treatment specifically for the skin.
Okay, how did that work?
Well, the goal is basically to flood the bloodstream with those amino acids that the skin cells are desperately starving for. You're bypassing the failing liver or counteracting the depletion caused by glucagon. And this can lead to really dramatic, sometimes quite rapid improvement in the skin lesions, often within days.
That must be such a relief for the poor animal. How is it administered?
It involves infusing a special amino acid solution intravenously, usually over several hours. Typically, you'd start maybe once a week and then adjust the frequency based on how the dog responds.
But as you said, it doesn't actually cure the underlying disease, does it?
No, that's the crucial point. It helps the skin heal by directly supplying those missing building blocks, but it doesn't fix the failing liver or remove a tumor that couldn't be operated on. So it's an intensive treatment. It can be costly, requires repeated vet visits, or sometimes placing a central catheter for easier long-term access.
What about nutrition? Given the whole amino acid problem, diet must be important too.
Absolutely. It's a really crucial part of the management plan. Feeding a high-quality, easily digestible protein diet is definitely recommended.
Any specific supplements?
Well, supplementing orally with things like cooked whole eggs or maybe whey protein powder can help boost the amino acid intake. It's generally less effective than the IV infusions for severe deficiency, but it's still helpful. Supplemental zinc and essential fatty acids, like omega-3s, might also provide some benefit.
And what if there are other problems going on, like if the dog also has diabetes or managing the liver disease itself?
Yeah, any concurrent conditions absolutely need to be managed aggressively. So if diabetes is present, that needs strict control. For the liver disease itself, vets might use specific liver support medications, things like ursodeoxycholic acid, same antioxidants. But again, these typically don't reverse the severe chronic changes seen in these cases. They're more supportive.
Okay, what if a glucagonoma is found, but it's spread or can't be surgically removed? Is there anything then?
There is actually medication called octreotide. It's a synthetic version of a hormone called somatostatin. It works by helping to suppress the release of glucagon from the tumor cells.
Does that help the symptoms?
Yes. It often leads to significant improvement in both the skin signs and the systemic symptoms caused by all that excess glucagon. It doesn't cure the tumor, it doesn't make it go away, but it can definitely improve quality of life.
And just dealing with the painful skin itself, what kind of local care is important?
Aggressive local management is really essential, both for the dog's comfort and to control those secondary infections we talked about. Warm foot soaks are vital.
Foot soaks.
Yes, maybe with Epsom salts or a gentle antiseptic solution. They help soften those really thick hard pads, clean the lesions, and reduce the bacterial or yeast load. Topical creams or ointments or even systemic antibiotics and antifungals are usually needed too.
And pain relief must be key.
Oh, absolutely critical. Those foot pads and other lesions are incredibly painful. So good pain management is paramount. Sometimes protective bandaging can help cushion very sore paws.
Is there anything vets specifically try to avoid when treating this?
Yes, the sources are quite clear on advising against using corticosteroids, like prednisone.
Why is that?
Well, steroids are sometimes used for skin inflammation. In these specific cases, they can actually make things worse. They can worsen metabolic problems, like potentially triggering or worsening diabetes, and they can also interfere with wound healing, which is already compromised. So generally avoided here.
Okay, so pulling all this information together,
Yeah.
what's the typical prognosis? What's the outlook for an animal diagnosed with necrolytic dermatitis?
Unfortunately, because the skin condition is such a direct reflection of severe, often end-stage internal disease, the overall outlook is generally considered poor to guarded.
That's really difficult news for an owner to hear. What kind of survival times are we usually talking about?
For dogs, the median survival time, sort of the average after the skin lesions first become apparent, is often quite short, typically in the range of, say, 3 to 6 months.
Only 3 to 6 months.
Often, yes. Now, intensive treatment, particularly those amino acid infusions, can dramatically improve the skin condition and potentially extend survival, maybe beyond a year in some dogs. But the underlying liver disease usually continues to progress regardless.
Is there any scenario where the prognosis is significantly better?
The one scenario where it's notably better is if a glucagonoma is the cause and it's caught early and it can be completely removed surgically before it has spread, metastasized. That offers the best chance for long-term survival, possibly even a cure.
And for cats, You mentioned it's even rarer and more serious.
Yes, sadly, the prognosis in cats seems to be even more grave. Survival is often measured in just weeks to maybe a few months, and it's frequently linked to aggressive underlying cancers in them. The sources really emphasize that true recovery, where the animal is actually cured, only happens in those extremely rare instances where the underlying metabolic problem somehow resolves itself, which is just not common with the typical causes like end-stage liver disease.
Wow. This whole deep dive into necrolytic dermatitis
Mm.
is, well, it's a powerful and honestly a rather humbling reminder of just how incredibly interconnected the body is, isn't it?
It absolutely is.
It just shows how a severe breakdown in something so fundamental, like amino acid balance, caused by a problem deep inside the liver or pancreas, can have such dramatic and painful consequences right there on the surface, on the skin.
It's such a vivid illustration of the body as a whole system and how failure in one critical area just cascades outwards. You really see it here.
And recognizing those specific skin signs early on, even though they look just like a bad skin problem, that's the key, isn't it? It unlocks the investigation into that serious internal disease that might otherwise be missed until it's even further down the line.
Precisely. It's about seeing the skin not just as skin, but as a valuable diagnostic window into the rest of the body.
And the treatment, while it's often palliative, focused on comfort, really aims to alleviate that suffering and provide the best possible quality of life. Because fixing the underlying root cause is usually just not possible.
That's generally the focus, yes.
Yeah.
Supporting the animal, managing pain, controlling infection, and improving their quality of life as much as possible in the face of that severe internal illness.
This condition really does underscore how these outward signs can be absolutely critical signals for hidden internal issues. And, it kind of leaves us with a thought-provoking question to maybe mull over, doesn't it?
Mm.
If such dramatic skin lesions can point directly to a breakdown in something as fundamental as amino acid balance deep inside, well, what other subtle, maybe easily overlooked outward signs in health in animals or even ourselves might be critical indicators of major internal imbalances or diseases that we haven't yet fully connected or even understood?
That's an excellent point for reflection. There's likely still so much to learn about those connections.
Indeed. Well, thanks for joining us on this deep dive into what is clearly a very complex and challenging condition.